Are you safer when you are at home or at work? The answer might surprise you. In 2005, 3.7 million people suffered disabling injuries in the workplace, and nearly 5,000 people died on the job. In homes, there were more than twice the number of serious injuries and almost 8 times as many deaths. As an employer, you know how important safety is in the workplace. But what about when your employees head home? Off-the-job injuries can affect your business just as much as those at work. An employee who falls down the stairs at home is going to be off work just as long as one who steps off the edge of a loading dock. But how can you help prevent accidents at home? It's easy, really. When you train employees for emergency care in the workplace, they take that knowledge home with them, making their whole lives safer. Statistics show that 25% of emergency room visits could be avoided if more people knew basic first aid and CPR. Emergency care training shows your commitment not only to your employees' safety and health, but also to their families and communities. It means the difference between a short and long-term recovery. It can mean the difference between temporary and permanent disability. It means more lives saved, which translates to less cost to you in workers' compensation, medical claims, insurance, and lost production time. The National Safety Council has been the leader in protecting life and promoting health in the workplace for over 95 years. We've expanded our focus to include safety on the roads, in the home, and throughout the community. In 1990, we established first aid and CPR courses to promote effective emergency response. Since then, we've grown to meet the changing needs of emergency responders at all levels of expertise. More than 70 national medical, health, and safety organizations have reviewed, contributed to, or endorsed our programs. We were the first national organization to launch a bloodborne pathogens training program to comply with OSHA standards, and we pioneered automated external defibrillation (AED) training for the industrial market. Since 1990, we've trained more than 8 million first aid and CPR and AED responders through 10,000 instructors and training centers worldwide. Since we launched our emergency care programs in 1990, other training providers have developed similar materials, but none have been able to match the breadth or quality of our programs. The National Safety Council's materials are continually reviewed and updated by experts in the field. They're compliant. Our standard first aid, CPR, and bloodborne pathogens courses meet or exceed OSHA requirements. They're complete, easy to use and understand. They're wide-ranging. We cover beginning to advanced levels, including basic and specialized topics. The programs are flexible. You can have one customized to fit the needs of your industry, company, and employees. Plus, you can choose the training option that works best for your organization and your budget. With 10,000 instructors and training centers worldwide, chances are we've got a location nearby. Or we'll come to you. Our instructors can train any number of employees on site.